How do you treat vaginal itches? Vaginal itches can be very, very, very discomforting. It makes a woman, I mean, it can destroy your whole day. What are the first measures that you can take at home, or like an emergency method you can use at home before going to the hospital, or when is it necessary to consult? This is what we're going to be talking about today. This is Stop Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women related health issues. If these are the kind of content you like to watch, then click on the subscription button. Let's dive right in. Thing is, vaginal itches, since they are very, very uncomfortable, you try to relieve yourself first at home before even reaching the hospital, and you might try to do one or two things at home before. If it persists, then you can go to the hospital. Now, when do you need to go to the hospital? You can go to the hospital if the symptoms are persisting despite all the measures that you've taken. And what are the measures you can take? The first thing is, it depends on the cause of the vaginal itches. The first cause, which is self-limiting, because you have discovered that you've used a new detergent and it caused the irritation, then you stop it. So once you stop it, it can stop on its own. Also, these are just some things which lifestyle which you can change, and I made a few full video on that. You can check on the lifestyle modifications that you can take to prevent these recurrent issues. Now, some you can take over the counter or even in the pharmacy. There's some creams which you can take to prevent just the itches. So maybe you might be having itches from irritants, and you can go and you buy a cream. Actually helps to just stop the irritation. You just apply at the level of the vagina and it stops. Then if it's a bacterial infection, therefore you're going to need an antibiotics. And maybe if it's a yeast infection, you're going to need an antifungal medication. Sometimes there are some various ovules which you can buy, which it actually insert into the vagina, and it helps to actually treat it locally, maintaining back the vaginal pH and the normal vaginal flora. So once you use this, sometimes you might even take some oral medications and it might not even help. You might need to take some ovules that is going to act locally. Now, like I said, it depends on the cause. So if you've bought some ovules or some cream to rub at your level of the vagina, and you use it for some time and you see that it is still persisting, you have to visit your healthcare provider. Now, with your healthcare provider, what type of infection it is, if it's a yeast infection, or so sometimes if it's irritant, it can stop on its own, or you can buy a cream to actually apply there, just like shaving. Men who shave their chin, once there's irritation, they can apply some cream there, which helps with the irritation and the itches, and it stops. So it's still almost the same thing. Now, once you do that and it does not help, it keeps on persisting, associated with vaginal discharges. If you start having associated with vaginal discharges, maybe now if it becomes severe, start having lower abdominal pains and even fever or tenderness, pains during sexual intercourse, please, 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 just go to the hospital immediately. That one is already severe. So just at the level of when you start having the itches, sometimes it can stop on its own. So if it still persists, visit your healthcare provider and they're going to give you antibiotics accordingly. So, but the main thing is that you should avoid douching, and treatment, it depends on the cause. If it's menopause, you are also put on hormonal replacement therapy. You are given some estrogen where you're going to take it, and it's going to help to moisturize back your vagina to prevent vaginal dryness. So these are just some methods in which these are just some things that you can use in order to treat yourself or do a first aid at home before reaching the hospital. You can also do what is called seed bath. Seed bath means that you put like water, a detergent, lukewarm water, like you're bathing a baby in a bath, a detergent and salt in a particular proportion, and you sit inside. That's for a while, for like 10 to 15 minutes, and after that you bathe and you wipe yourself. So these are some kind of things that you can do at home. But if it persists, please visit your healthcare provider to receive the best medication. Thank you very much. And if this was helpful, don't forget to click on that subscription button and share the videos to other women out there. It might just help a woman out there. And if you want to have a private consultation with me, click on the link on the description box and you get to me. Bye bye.